Our particular mobile health clinic, because there's several in the area, our particular clinic goes out into the lower income neighborhoods, schools, community churches, senior sites, daycare sites, and we do preventive health screenings, which basically covers the blood pressure, glucose screenings, and then our lipid panels. We also do children's immunizations, women exams, also the state requirement of screenings for our school-based clinics, and they're free of no cost. All of our services are free. Normally what we do is we go to a site, we start to set up, we take our registration forms and all the papers that we need and take them into the agency that's hosting us. We explain all of our process, and then we have our walkie-talkies in the corner over there that we use. I set my computer up as you see here because we do use electronic health records in our unit. We have all of our supplies up here as you can see, and we have them all nicely labeled. So this particular site is for our preventive screenings, and this is for our children's immunizations, and then we have plenty of storage space for our educational materials, which is nice. And then also underneath the bench there's a lot of storage space. So you wouldn't think that this small unit would have this much storage space, but it does. So we really are happy about that. So we get all set up, then we call them in, they come on in. We generally will have them come in and sit in our chair here where we do our blood pressures and our intake. We call this our intake chair. And I'll get all the information, get them registered, and then after that, then they will go on over here to Janet's phlebotomy chair. And she will do the blood draw and do the blood sugar. And the nice thing about this is that we're right here, and she's our medical assistant, and if she needs some information, I'm able to help her educate the patient. And if that particular patient has hypertension or the blood sugar is out of control, which that happens to us a lot, that we have to educate them, and as a registered nurse, I'm able to help. After we're through drawing the blood, we explain everything to them, their findings that we had, and then we'll tell them, we'll mail their lipid panel results to them, and we send them on their way. And we call somebody else in, and we just continue to do this. It's easier to maneuver and get about into the community. We don't have to worry about the 8 parking spaces that we do with our larger 40-foot unit. We can drive it, the nurses. We don't need to have a CDL license like we do in our big truck. So that helps us. That's an advantage to having this small unit and the maneuvering of it. We can go out further, and it's more economical for us, and we're still able to service the people. And we rely on the particular clinic site or the agency that's hosting us to provide a room for us, for our patients to register in the area. And then this way we're able to just have them come in to the area. We communicate with the agency and ask them to send us some more. We're ready. So it's been very good for us because we have been able to just go 2 of us out versus and divide our clinic sites up where we can send 2 of our other staff or 3 staff members to one site, and then we'll be going to another site at the same time. The air condition is a plus for the South. We're able to, because it's comfortable, we're able to continue to work. We hope to reach out to more people in our community and to be able to service more people and be able to get out there and educate them. And some of our patients that we see have never been to a doctor. This is their yearly checkup. A lot of the people that we see have no insurance, or either undocumented or have insurance. They're the working poor that aren't able to provide and pay for their copay. And so I'm hoping that in the future maybe we can bring a nurse practitioner on board and maybe do a little bit more primary care, you know, or just to reach out to the communities. So those are the things that we do in this little unit, which is wonderful. We were real excited when we got it.